Good day, guys. Today in this video, we're just going to have a quick look at bandaging with hemorrhage control or bleeding control, etc. So again, the first thing we look at is our action plan, our primary survey. I've asked the patient if I can help them, and they said yes, I can. So the first thing we need to do is position our patient in a position of comfort. Now, we're just going to simulate a wound here. We need to have a look at the wound. So we talk about indirect pressure and direct pressure. First thing we need to look at is quickly have a look inside the wound to make sure there's nothing sticking out of the wound, so they haven't got any penetrating injuries, etc. Once we've done that, we then can get a clean pad. Here I'm using a triangular bandage as a pad, and we can hop down beside our patient, and we're now going to apply direct pressure over the wound. So when I apply direct pressure, I'm actually applying full-on direct pressure and elevating the part. Alrighty. So it's also a good consideration to have if a patient is now looking pale, cold and clammy, they're in shock. The best place to have the patient is on the floor. They can't fall any further. So we're applying full-on direct pressure here. If it's still bleeding through, you need to go back to your basics and go on with full direct pressure. Okay, so you're not applying enough pressure. Let's just take it that we've now controlled the bleeding. I'm going to get Wade to give me a hand here to hold the pad back on. Keep holding some pressure on me. I'm now going to apply a roller bandage. With your roller bandage, you have your tail and the drum of the bandage. And as we say, it's a roller bandage. I'm going to come down here and I'm going to secure my bandage up here. And now with a figure of 8, thanks mate, I'm now going to go through and apply pretty firm pressure across the area. Again, using a figure of 8 bandage. Okay guys, in this video we're going to talk about a penetrating object. We've simulated here someone who has a protruding object, knife, etc. that has gone in. So the way we're going to control this is we're not going to pull the object out, obviously, do further damage, cause pain, all that type of stuff, extra bleeding. Here we're going to make a ring pad. Simply with a triangular bandage or some rag, you're going to wind this around your fingers like so. Once we've done that, that just goes over the object like so, and we're going to get Wade just to hold some pressure around there. Okay, like so. And with our bandage, again, if I can secure the bandage around this way, so just around the wrist, using our figure of 8, we're going to apply pressure around that wound. So initially what you could do is apply some direct pressure like we did in the previous video and go from there. In this particular case, guys, we also need to have some consideration for perhaps applying the splint here so we don't get any abnormal movement, etc. Again, we want to reassure our patient. Someone's lying down and they're going to see that happening, of course they're going to be quite anxious. So we reassure our patient, splint, etc.